Amy, over to you.
Thanks, John. I'm very pleased to be here and pleased that the coalition is sponsoring this event. The Coalition for Behavioral Health is the umbrella organization for over 100 community-based behavioral health providers in the New York metropolitan area. We provide training to the workforce, advocacy, and are starting actually a business initiative to really help our sector. Our agencies that have been really quite heroic through this pandemic while experiencing financial losses are serving many, many New Yorkers with many more requesting services. People that are experiencing grief reactions to loss of lives, loss of jobs, experiencing fear, anxiety, alcoholism, and actually we're seeing an increase in substance use services as well. Our workforce, also essential workers, many of whom have been able to work from home through telehealth, but many who still come into offices or residences where they serve people with mental illness while dealing with their own personal losses. And that workforce also has been heroic during this time. We are looking forward to moving ahead to coming out of this crisis and to be able to serve so many New Yorkers that have so many pressing needs and really unprecedented. Without further ado, I would like to introduce our panelists, all of whom I know, and all of whom I have the most tremendous respect for. Council Member Diana Ayala, Chair of the Committee on Mental Health, Disabilities, and Addiction of New York City Council. Susan Herman, Senior Advisor to the Mayor and Director of the Mayor's Office of Thrive, New York City. And Anne Marie T. Sullivan, Commissioner, New York State Office of Mental Health. I can't think of a more dedicated trio, and I am so pleased that you're here and that I've had the privilege of introducing you. John?
Great, thank you, Amy. And just a few notes for the audience. There are a few functions on Zoom that I'll point out for the audience. To ask a question, click on the Q&A button at the bottom of your screen. We'll take a few audience questions as time permits at the end of the discussion. You can also interact with other webinar attendees through the chat function at the bottom of the screen. You can use a drop-down box to share comments with all attendees, not just the panelists. And please do keep it civil and on point. We have some actual comments in there now in the chat room that the audio is a little bit low. We'll try to resolve that as quickly as we can. You can also change the view settings in the top right-hand corner of your screen as well. Now, over to our panelists. When we planned this, the main topic was going to be coronavirus, and it will continue to be the main topic. But there's been a lot of unrest and protests lately regarding law enforcement, not just in New York, but other parts of the country as well. And I think there's a real mental health piece to be explored there. So I want to get a couple of questions in on that. First of all, there have been calls, for example, to defund the NYPD. There was an op-ed in the New York Times just a few days ago. No more money for the police, redirect it to emergency response programs that don't kill Black people. The authors wrote, "The only way we're going to stop these endless cycles of police violence is by creating alternatives to policing. Municipalities can begin by changing policies or statutes so police officers never respond to certain kinds of emergencies, including ones that involve substance abuse, domestic violence, homelessness, or mental health." Just wanted to get a bit of reaction from all three panelists on that argument. And Susan Herman, if we could start with you.
Well, thank you for that question, John. I think that the first thing I'd like to say is that witnessing the kind of violence that the whole country has watched over the last week or so is traumatic for everybody. But it's because it's been broadcast that more and more people have been able to see what Black and brown people live with every day of their lives. So there's a trauma that the country and the city is sharing now by witnessing this violence. but we've known for quite some time that there's racism in our criminal justice system, in our healthcare system, in our education system. It pervades our society. In terms of the specific question about whether we are developing other ways for what I would call health-only responses, New York City is really leading the way in that regard. We have for some time had mobile crisis teams that are social workers and peers, people with lived experience, sometimes nurses, that are deployed by hospitals and by NYC Well. You can call and they will be at your house in a number of hours. And actually, in this next budget cycle, our hope is that we will be able to fund more mobile crisis teams so that we can get that response time down even more. And you can get there within a couple of hours. That's our goal in a city of 8.5 million people, to have that kind of a response that any citizen can call and ask for someone to come to their home to de-escalate a situation, to assess what's going on, and refer people to services is really quite extraordinary. We also have what we call heat teams. And these are, again, teams of a social worker and usually a peer who both respond to particular requests from agencies or 311 to assess something that's happening in the public. And it's also a way to just walk around communities and approach people and offer services if they see someone who looks like they're troubled. So we're very excited about the heat teams, the mobile crisis teams. We have mobile treatment teams that treat seriously mentally ill people that are all healthcare. There are no law enforcement people there, and they have people who they see on a regular basis who they treat in the community, people who have serious mental illness and may not be able to adhere to a typical clinical regimen at a clinic or at a hospital. So we have lots of health-only responses, and we continue to experiment with broader use of each of them.
Thank you, Susan. Council member, if you could follow up on that, any points to add, your perspective there?
I mean, I think that we're living in an unprecedented time when we're able to physically see, right, the injustices that we've been talking about for generations and generations. And I just want to say that I stand with, with the protesters. I feel, I feel your pain. I've actually, had very difficult conversations in my own household this week, being the parent of, 3 young men of color. One of whom was, many years ago, not that many, victim of stop and frisk, right? And having that happen to him quite regularly affected his mental health, right? It affects a young person's, interactions with law enforcement. It affects their self-esteem, and that coupled with the fact that most of these these young people, we've been quarantined for 2 months. People are just fed up and they're tired of being tired, and I think that they want to be heard, they want to be seen, and that's what we're seeing on the streets. We're seeing that play out right now. But I think that this is a real opportunity to actually listen and to effectuate change in a real way, in a way that really positively influences the way that we shape policy and the way that we fund programs and services in communities of color.
Sure. And Commissioner, anything to add from the state perspective on this point?
Just to echo, I think what's already been said, that the tragedy of the loss of life of so many Black and brown people over the years is a trauma that affects all of us and affects generations. It has an impact on children, and it has an impact on families, and it's something that I think we have to work with. It does have mental health consequences. It does have depression, anxiety. In answer to your question, I think that the way we have across the state, similar to what Susan has described in New York City, done a lot of work with police forces and I think it's over probably about 50 jurisdictions across the state, various local counties and sheriff's organizations. And what you do is you do a lot of training with the police. And they really truly welcome it. I mean, our experience has been that no police force has said, no, don't come to us. They welcome the training. We work with them with the mobile crisis teams, which are across the state. And for example, in Orange County, they've done a marvelous job of the intercept model, which looks at where you can bring people to prevent incarceration, to prevent them being arraigned, to do first steps. So throughout the state, we're working on this. We need to do more. It needs to be everywhere, and it needs to be easily accessible. So that if you call with a mental health issue, you always get a team that can work with you. Sometimes you need the police, sometimes you don't. But I think we need to have that kind of triaging system. And we have it throughout the state in pockets. We don't have it everywhere. And that's something we're working on expanding.
Sure. And one more question or one more perspective to this before we get specifically to coronavirus. And I think you touched on, Commissioner, the aspect of training law enforcement. You know, there's been some reporting lately about Minneapolis where you had this killing that spurred a lot of this protest and unrest. Minneapolis seemed to be doing everything right. They had all these trainings they put in a few years ago, tried to incorporate mental health. How well does it actually work to train, say, the NYPD? And then a specific related point there, the city, the nonprofit news outlet, in a report they put out in March, they said, among Thrive NYC's early stumbles, a plan to train all 36,000 NYPD officers on how to respond to people experiencing mental distress has fallen well short of its goals. Through December 31, just under 16,000 officers had been given the so-called crisis intervention team training. So Susan, back to you on those 2 points.
Sure. I think there's a real need, the most pressing need for crisis intervention training, which has proven to be quite effective across the country, is to train the people who actually are on patrol, officers who are interacting with the public on a regular basis. And that's certainly not all 36,000 uniformed members of the police department. It's about 24,000. And we've trained over 16,000 at this point, which means that in every precinct across New York City, over 75% of the people who are on patrol have been trained in crisis intervention training. So the national standard is actually that you train about 25% of the people in a police department, the people who are on patrol. We are well over that standard, but we are continuing to train people. That's one of the unfortunate outcomes of the COVID crisis, is that training has been suspended for the last couple of months. But as soon as we can have people in a room together and do the role plays and have the panels with people talking about their experiences with police departments, both positive and negative, we'll go back to that training until we train everybody. It is part of the police academy curriculum at this point, and there's a commitment to just continue to train and continue to train. What the research shows us is that officers who've been trained in crisis intervention training understand better how to identify signs and symptoms of mental illness, assess the level of danger more accurately than people who haven't been trained, and respond appropriately. So this is a commitment the NYPD has made, and I don't see it stopping.
Sure. And then council member, wanted to see if you could follow up on this, but also specifically some elected officials in New York are now calling for defunding or decreasing funding for the NYPD. We are, seemingly in a recession, yet I believe it's your boss at the time, then Council Speaker Melissa Mark Viverito, who in fact pushed successfully to dramatically increase NYPD staffing and the budget. What is your take on the situation and specifically the mental health piece?
I think that, the NYPD's budget is seriously inflated, and I believe that there's an opportunity to really, look a little bit deeper into pegs that have been instituted throughout all of the city agencies. And I think that there is a lot more that the NYPD can do. We have to responsibly balance this budget, and we don't want to do that off the backs of our young people. We have programs and services that, serve individuals in real time that are necessary. And I think that, we have to be really responsible about looking at the NYPD's budget. I wouldn't say that, I'm in favor of defunding, the NYPD. But I believe that, that there is a serious discussion that needs to be had about just, how significant or insignificant the cuts that have been proposed to date have been. The mental health piece question, could you repeat that? Because I kind of lost my.
Just how well it's working to train law enforcement officers about mental health and whether that's
Yeah.
been effective.
I've actually been privy to a lot of sit-ins with Susan Herman and some of her officers, and I have a really good relationship with the officers in my district. I happen to have, I believe, 6, 7 precincts that I work with pretty closely, and they're very receptive to it. I think that they're, but I also think that there has to be a larger conversation with the community, right? That there has to be more sensitivity training, because there is implicit bias, and we, would not be honest if we didn't acknowledge that exists, right? And so it's important that, police officers are interacting with the community in a different way, in a way that really allows us to see each other as human beings. And I think, but I would say that, I do see an interest in the NYPD to do that. And I think that they have been working, to inching their way, towards that goal.
Sure. And I don't want to pivot to coronavirus, but Commissioner, I know you touched on this a little bit. Any more you want to add on this point?
Just that training is something that is ongoing. Sometimes people think you can do like a one-shot training and that works. And that's not what's happening in the city, and it's not what's happening in the state. And you need to have debriefings when incidents occur. You need to talk about how you handled them. If you do all that, I think training's effective. But sometimes that's not what happens. So there's training and there's training. And I think you have to be careful when you say, well, is it working? It's what kind of training are you actually providing?
Sure. And then moving forward, the coronavirus. What is the mental health impact of the coronavirus? Whether it's, deaths, serious illness, isolation, anxiety, what impact is that having on New Yorkers, and any kind of tangible numbers we can provide as to what is happening here in New York? And I guess Commissioner Sullivan, let's start with you.
So I think the impact is what you could kind of expect. I mean, from the isolation, from the anxiety about the virus, from individuals who so sadly lost loved ones or colleagues. There's anxiety, there's depression, there's post-traumatic stress, and we're beginning to see those things. When you talk about numbers, I think the numbers are not quite there yet, but you do see things like numbers of the helpline. We have a helpline in New York State, and there's been 17,000 calls. Our text line, which was there even before coronavirus, is 50% more calls. I think New York City can describe that they've had more calls too. So we know that people are in distress, and thank God they are actually asking for help or wanting to talk to someone, which is probably one of the best preventive measures. So we know from past experience with these kinds of disasters that there will be anxiety, depression, there will be post-traumatic stress, and we have to work to try to prevent that from what can be either just a response to the disaster to becoming something very serious, which can be ongoing. And that's what we want to prevent.
Sure. Susan, over to you.
Well, I think I would echo the Commissioner's statement. I think it's important to realize that it's common to be sad or anxious during a situation like this. It's a perfectly natural response to something that none of us have ever experienced before. But just to make it a little bit more concrete, I think that losing loved ones and maybe losing a job and being worried about whether you can afford food or whether you can afford rent, that those are very concrete things that have happened to hundreds of thousands of people, and that produces depression and anxiety. On top of that, we have more social isolation, and people, particularly aging New Yorkers, about 1 in 3 of whom live alone anyway, and are particularly vulnerable to depression and loneliness. Now, when they're not venturing out at all, the risks of depression and anxiety, suicidality among the aging is even higher. I would also say that we need to think about, and I think there's been a lot of discussion about, our frontline workers and our essential workers who are out every day risking their lives. And many of them, particularly our healthcare workers, are exposed to a level of death and trauma and grief than they've never experienced before. None of us have, unless people have been serving as medics in combat. So I think we're going to be seeing another wave of an enormous mental health care crisis in New York City. And we're preparing for it. But right now, it is true, we are encouraging people to call our helpline, which is 188-NYC-WELL, or to get on the NYC Well site, because you can download the apps. That's many people's preference these days. Or you can text WELL at 65173. We saw about a 25% increase between February to March in incoming contacts, and then again, another increase in April and another increase in May. We had about 120,000 people go on to the NYC site in 1 month. And that tells us that people are looking for resources and trying to find assistance any way they can. We get about 1,200 incoming calls, texts, and chats a day in New York City. So we know that people are reaching out. We know that they understand what kind of services you can get from NYC Well. You can talk to a counselor. You can talk to a peer if that's what you want to do, someone with lived experience. You can get a referral to short or long-term counseling. And if necessary, as I mentioned before, you can, if your conversation indicates some sense of urgency, a mobile crisis team can be deployed and go to your home.
Thank you, Susan. Councilmember, anything to add?
I mean, I agree with everything that's been said. I think that the impact is all of the above, right? It's death, it's, illness, isolation, unemployment, anxiety. I mean, we're seeing this day in and day out. I mean, I don't, if you're on social media, you can't help but see it. People are regurgitating their feelings onto a social media platform because they're desperate, to be heard. They're suffering. I'm actually, I had this conversation with Susan Herman just, not that long ago about, the number of people that are calling the NYC Well, and really just, curious to see how many young people are calling in, because I actually live with an older adult, right? My mother, I got sick in April, and my mother got sick, soon after, but it was because she continued to want to come in to the area where I was in because she suffers from mental health issues, and she was isolated to a corner of the house by herself with no one to talk to. And that was really, eating away at her. And so, she came in contact with, with us in an attempt to seek, some sort of companionship and somebody to really talk through her feelings with. But I also have young, men at home. I still have young boys at home that are struggling, right? I have an 18-year-old that was on the verge of graduating this year. So he lost his, ability to go to prom. He lost his ability to be able to go to his senior trip. These are, monumental experiences. Like this is never going to happen again, right? He will never have that again. He was we abruptly, took them out of the school setting where they at least had an opportunity to interact with their peers, right? To get the social emotional needs that, met. And we, they didn't have that, and it's happened overnight. It was so abrupt in the way that it occurred. And now, we're talking about cuts to programs and services. So that means that they may or may not even be working this summer. So I'm really scared about what the future looks like, and I'm really even more afraid of what it looks like for our young people, because they don't yet have that skill set. They don't, to really understand their feelings in that way. So I'm curious to see how many of those young people are taking the opportunity to text into NYC Well, which we've seen an increase in. And I'm assuming that because of correlation between youth and, the use of electronics, that some of that, may be attributed to young people becoming more aware and utilizing that as a tool to really engage.
If I could just respond to that and just say that it's not just that young people are reaching out to NYC Well, it's also that all of the mental health services that were school-based before COVID, before students had to stay home, are all operating virtually. So if you were participating, if you were a client seeing someone in a mental health clinic at school, you are still seeing that counselor virtually. If you are experiencing a crisis, the school response clinicians that were hired last fall are still responding to students, either in person or virtually. If you are needing help, students know that there's a hotline that they can call. So students are reaching out in large part through the Department of Education's infrastructure that has continued. Almost all of the Thrive resources, including those for students, are operating now either on site or virtually. We have continued to provide the mental health services that we were providing pre-COVID, whether it's mental health services in a shelter or in a senior center. Now those are virtual. In a shelter, they're still on site. In the runaway and youth drop-in centers and residences, still on site. Whether it's a victim advocate that was in a precinct, now it's virtual, it's phone calls, but we are still providing the services that we were prior to COVID.
Yeah, and I would just like to add that across the state, you know, the clinic services, all the outreach services have continued, largely through virtual. And we have found, you know, we did a survey of our clients who use those services, and we found very high rate of people really liking using some of the virtual services. So I think the future, in many ways, of some services, I think we're going to look at differently, because I think this kind of reach into areas where we weren't able to reach before, we can get people now in their homes, et cetera. But one of the big goals of the governor and the state has been to keep all our services going through this time, and I think we've been pretty successful at that. The vast majority, just as with Thrive, have continued, largely through tele, to be able to reach out to people and to provide intakes, to take in new clients, to continue to see the clients that we see over time, and to make sure people get the services that they need, both mental health and substance use across the state.
Sure. And just a note to the audience, if you have any questions, I see some good questions coming in the chat, please plug those in the Q&A button. Just hit that and add that in there, and I can review it, see if we can squeeze some of those in. Before we move on to the next question, though, we've hit on some of this as well, the programs and resources available. Any other programs, resources, links, phone numbers anyone wants to add that we haven't already mentioned?
Yes, I would ask everyone to go on the Thrive NYC website, and you'll see right on top of the banner, there's a guide for mental health resources to access while staying at home. And you'll see services that are tailored to children and students, to veterans, to aging New Yorkers, to people who are abused or victims of crime. And it's all there. I don't want to go through each of the different websites and numbers. If you go to this guide, you'll see all of it. And NYC Well is kind of the gateway to clinical services and to talking to someone in the moment when you need to talk to somebody. But this guide tells you about a wider range of services that are tailored to specific categories of people. So please go on the Thrive website, look at the guide.
I'd just like to mention the emotional support helpline that the state put up, and we have, if you call in, as a healthcare worker, you can reach someone who's specialized in working with healthcare workers, or if you're from the general public, you get someone. They're all licensed professionals, they're volunteers that have offered their time to work. The average time someone spends on the line is like 15 to 20 minutes, so people have really an opportunity to really talk about what they're feeling. The vast majority are not individuals who are in the mental health system. They want to talk about family issues that have come up, or losing a friend, or if they're socially isolated, what can they do to feel better? And some call back, some ask for referrals, but most feel much, much better after that contact, which is something that we're really learning can be so, so critical for people. So that number, which you can find on the OMH website, but also it's 844-863-9314. We also have a text line, which has gotten a lot of attention over the past 2 months, and that is Got 5 text to 741-741, or New York Frontline 741-741. And those text lines have really gotten lots of use over the past couple of months, and lots of people call, and we've had, I think in 2 months, we've had 10,000 texts, conversations on the text line from about 9,000 individuals who've actually contacted us. So please use the text lines, please use the emotional support lines, and you can also call a provider, or if you need crisis services. You can call directly. All the counties, including New York City through New York City Well, everyone has crisis links on their county websites and on the OMH website as well.
Thank you, Commissioner. Another question or another issue that's come up already during the discussion is funding. Kind of, if you can give an overview, what kind of federal funding are we getting on this front, if any? State funding, city funding, council member, obviously there's a city budget that has to be completed. Will there be any cuts in mental health? Is there an argument that we in fact need more funding for mental health? Council member, I'll start with you, and then anything else that we want to add.
I was making the argument last year that we needed more. I mean, I run the mental health, disabilities and addictions committee, and we have more groups that are desperate for more funding than we actually have access to those dollars. And certainly, again, we're looking at we're taking a responsible look at our fiscal reality and looking at the budget and scrutinizing it. But I don't believe that the council has any intentions of making cuts to programs that provide mental health services to the neediest of our constituencies. And so we're still in discussion right now. I don't really have I don't have news that I can share with you today, other than we remain, we've always been and we remain committed to servicing our communities in a way that is equitable and fair, and that has not changed.
Susan or Ian, anything to add?
Just to add that, before COVID, when the state budget came out, in terms of Medicaid, and there were a lot of redesign in Medicaid, there were no reductions to mental health. And that was said explicitly, and I think it was a real awareness of the importance of mental health. Now, I know that it's really an uncertain time now with what's happened in terms of the deficit. The governor's been very open about this, the $10 billion revenue loss to the state, which is going to continue to grow. So we don't know what the future brings if we don't get federal aid. But I think there is a definite awareness of the importance of mental health during this time. And we are also applying with the city and with many other counties for a major FEMA grant that would help do a lot of crisis counseling across the state. We were asking for 500 counselors in the city and 500 counselors upstate. So we are getting the opportunity to look for funding wherever it's possible to enhance the services during the epidemic.
Sure. And Susan, and many of our audience members will know this, Thrive NYC has come under scrutiny over the years, questions about metrics for success and budget. And there's been sort of a reworking over it over the last year. You can elaborate on that as needed. But Gary Belkin, who helped create Thrive NYC, he wrote a piece for us in March and said that, quote, those critical of Thrive NYC for not doing enough for serious mental illness actually demand too little and aim way too low, narrowing rather than finally broadening the scope of what mental health system is tasked and resourced to do, heads in the wrong direction. Any reaction to that?
Well, I think what Dr. Belkin was getting at in that piece was that in order to really focus on mental health appropriately in New York City, we chose to look across the lifespan and to try and address mental health needs as they emerge when you're a child and a student, so that some of the problems that people face as adults could be averted. We tried to have prevention work, early intervention work, again, to try and get in there with appropriate treatment as early as possible. Not all mental illness can be cured, but almost all mental illness can be treated. And the earlier someone is treated, the better the course of their lives. So we've also worked on crisis response and intervening when people are in a very serious state. So what we've done over the last 15 months that the city has had this mayoral office for the first time in its history, focusing on mental health, is try to define the categories of our work and show that we not only have reached hundreds of thousands of people, but what the outcomes are. So we are interested in, we are not a mental health system that exists. That's mostly through our health department and health and hospitals. But most of the funding, let's back up a little bit. Most of the funding for mental health in New York City before Thrive came either from the state or the federal government. That is still true, except that Thrive has invested in trying to fill critical gaps in our mental health system so that we can serve people, more people, in new ways and in new places. So where we had all mental health focused primarily in health and hospitals and the Department of Health, we are now supporting programs in 12 different city agencies. The money goes directly from our budget department to those city agencies. It doesn't come through Thrive. It goes directly to those agencies. What we do is to provide oversight to make sure that they are measuring what they are doing and they are staying clear to the model that they proposed. So over this year, we have not only been putting out regularly output measures, meaning how many people do we reach regularly, but we've created 90 outcome measures for all of our programs. And any New Yorker can get onto our website, look at our budget, and look at all of our metrics. So in my view, it's kind of old news to say we haven't clarified what we do or what our metrics are. They've been up on our website for several months.
Sure. Thank you, Susan. A quick note to the audience, we'll take questions from you soon. In that Q&A function, you can actually vote on a question you like, and if we get a lot of votes for a question, it'll move it up to the top of the list. So feel free to scan through those and vote for questions you like. But Councilmember, first, I'd love to hear from you responding to the remarks about Thrive NYC.
Thrive. You know, I think I want to be really careful with what I say, but because I think that there's been, you know, I think that that Thrive was very well intentioned, right? I think that initially there were a lot of hiccups because I think for me, and you know, this is just my own personal opinion, I feel like there were a lot of ideas, right? It's almost like we purchased the furniture before we had the house, right? And now we have Susan Herman, and she provides that house for us, right? She provides a little bit of that structure that we were lacking, the transparency and, you know, where those public dollars are going was really, really important. But I never had a doubt that the money and the resources were going to the communities that needed it the most. And I think that's just as important as the question of the transparency. Because, you know, these are the same programs that have been providing services in Black and Brown communities for generations that are, you know, benefiting from the funding that is coming from Thrive. And so we need to be really careful that we don't politicize an issue so much that then we hurt the very people that we intend to help. And so I'm very clear on that, and I will hold the administration, you know, to task when they need to be held to task. But my position has always been that you know, so many of my programs, when we fund geriatric mental health with these, you know, programs, we're funding, you know, access to services in schools to runaway youth. These are real needs, right? And they're funded through Thrive, unfortunately, whether you like it or not. And so to say, you know, we want to defund Thrive is to say that we want to defund all of these services that will, you know, disappear. And I don't think that, you know, that should be part of the discussion ever. But I think that especially in light of a pandemic like the one that we're seeing now, that, you know, that we should be very clear about our messaging, and you know, just be fair and equitable.
Sure. A follow-up there. Again, you could ask plenty of political questions about Thrive, but one policy question that I think has come up is, over time, how much is devoted toward severe mental health as opposed to other kinds of issues? And I guess both at the state and city level, how do you balance that? How much goes to severe mental health, people with those issues, especially now when you have so many more people with varying degrees of mental health problems that they're navigating? And Susan,
no, I agree. I think that that's an important part of the conversation. You know, this is a conversation I have had this conversation with the administration multiple times. I have a brother that suffers from severe mental health issues. It was very difficult from the perspective of a family member to access care for him, right? I actually was also, I think it was at the HEAT program, Susan,
Mhm.
We had a press conference and was able to see the impact of that program on a person who has serious mental health, right? That connection and being able to stay in touch with social workers, even with law enforcement, that, you know, is touching base and making sure that people are making it to appointments, that they're taking the medication, that if they're suicidal, there's someone there, you know, immediately to help remediate that. So yeah, I always feel that we could do better on that front. I think that everybody agrees on that. But I think that, you know, to say that nothing is being done is also not a fair description of what's happening. I've seen it, you know, firsthand, but I continue to struggle, and I continue, thankfully, I have, you know, the opportunity to sit on this committee, to have these conversations, and to really be able to share the perspective of my constituency and my personal experiences as a family member of a person with a severe mental illness, right? What are those barriers to access to care that he continues to see, right? How do we make those better, and how do we make those improvements? And I think that's my mandate, right? And my working professional relationship with the administration is reflective of that. And we continue to have those conversations, and hopefully we'll be able to add. But I think that, you know, the First Lady's priority was really in the beginning they were looking at the onset, right? And trying to avoid, you know, to trying to deal with the crisis and the issue from the beginning, so that it didn't get to a point where a person, you know, had been on the street for years on end without, you know, access to services and, you know, medication or treatment. So, you know, there's value in both, but I think that definitely there's much more that has to be done. There always will be.
You know,
So if I could just say, I think that, you know, treating the seriously mentally ill, that's a big thing, what I do every day in the state. It's critical. It's critical to have the dollars to do it, and it's so important. But what we don't pay enough attention to, and I think this is what Thrive has alerted us to, is prevention in mental health. And I think that's true of our whole healthcare system. Think about it for a minute. We spend tons of money at end-stage cardiac disease, end-stage pulmonary disease. But as a nation, we don't put enough money into the preventive services that are needed. So if you step back for a minute and you look at policy, I think policy that brings in that early prevention, you're not going to see the same results you would see by treating the mentally ill today, because it's a long stretch with prevention. You don't see an immediate result. But don't be careful about not saying how important that is. And in mental health in particular, we haven't done enough of that. We have studies that show how important it is, but we haven't invested in it. So I think it's a balancing act. You have to balance. But you can't say, oh, let the prevention go, just work with the seriously mentally ill, or just work with prevention and don't work with the seriously mentally ill. But be careful. I think Thrive was a tremendous, has really pushed the prevention agenda in a way that very few other programs have. And I think that's important, and it should be respected for that. I know it's had some difficulties, but it should be respected for that.
And out of fairness to Susan, you only came on, I think, February of 2019. So.
yes.
Right.
I've been on for a little over a year, and I think I would like to pick up on what Anne just said, that because I never really explained what the 4 categories are that Thrive is focusing on, and we believe it creates the balance that she's talking about. The first category is promoting mental health for our youngest New Yorkers, and that's the prevention, and that's early intervention. The second is eliminating barriers to care, trying to find out why it is that there's so many New Yorkers who have a mental health challenge who do not seek or receive help for that problem. What is it that we can do to eliminate barriers, whether they're barriers of language, barriers of race, barriers of geography, income, insurance? What is it? We work on eliminating barriers to care. The third, though, is reaching those with the highest need. And the fourth is strengthening our crisis prevention and response. So what it comes down to, if you look at our work in shelters, our work on mobile crisis teams, our work on mobile treatment teams, we are spending about half of our budget working directly with people with serious mental illness. But we are very clear that we want to work on prevention and early intervention as well.
Sure. And one quick follow-up for you, Susan, a couple audience questions about the HEAT teams. If you could just explain that in a little more detail.
So I always try to remember that HEAT stands for Health Engagement, Assessment, and Treatment. And these are counselors or peers, sometimes a nurse, who respond to specific requests as well as go out into various neighborhoods and canvass the community with, jackets and shirts that indicate who they are, and offering support to people who they believe could use some assistance. One more innovation that we have begun that unfortunately was put on pause because of COVID. We've created the first 2 support and connection centers in New York. Anne knows that there are others in other parts of the state, but New York is catching up. And these are places where the heat teams or even police officers could bring someone, offer to bring someone. They would go only voluntarily to get assistance with mental health problems, substance use problems. They can stay there for a few days. They can kind of get out of the crisis that they're going through. But this is an alternative to an emergency room that might not be able to spend real time with them. And it's a way for everybody to offer assistance based in a community to serve just the people in those precincts. And Councilmember Ayala has one in her area, I believe. And we hope to open the second one soon.
We have a lot of audience questions here. And again, if you want, in the audience, you can vote on questions you like to move them up to the top of the list. But one that came in earlier, are mental health prescriptions covered during COVID, whether or not you have insurance? If so, how? Guess we'll have to.
Well,
Yeah.
I would, go ahead, Anne.
Yes, I mean, basically, yes. If you have insurance and they are covered. But if you don't, what you would do is you would go to either one of our clinics, in the state clinics, or the Health and Hospitals Corporation, or places where you can get care that basically, irrespective of your ability to pay. And in that context, you would see a physician, and the physician would write prescriptions. So basically, it's just as it would be without COVID. People who don't have insurance are covered for their prescriptions through a variety of mechanisms, whether it's in the clinic systems or is it in uncovered care. So there's no reason anyone shouldn't be able to get it. They may now have a televisit with someone versus an in-person visit to get that prescription filled, but they can get it just now as they could before.
Sure. And maybe this was touched on earlier, but telemedicine, telehealth, do you think this is a pivotal shift, that a significant part of the population will adopt this, and providers will adopt telemedicine, and maybe that's a silver lining to the coronavirus going forward?
I do believe that many people who are hesitant about that first initial visit or talking to somebody and going, and also the time it takes and the expense it takes to go someplace, will engage in telemental health and telehealth. And for some, that will be the entire way they relate to a therapist or a counselor, and others will begin that way and then move to in-person or be able to go back and forth. But I don't think we're ever going to go completely back to not using telehealth at all. It's too convenient, it's too easy, it's too attractive, and why not help people in another way?
Commissioner?
Yeah, I absolutely agree. I think that there are some things that still should be in person, and I think there will be times when that will be there, but I think this is going to grow. And I think providers were more reluctant sometimes, I think, than the clients were. So I think now that it's happened and providers have had this experience, I think it's going to grow much, much faster than it would have without COVID, to tell you the truth.
Sure. And Susan, something you mentioned reminded me of another question, the stigma around getting mental health assistance of whatever kind. I have a relative myself who seemingly needs to get therapy of some kind and just won't do it. Have you seen any improvement, any of you, over however many years, 2 years, 5 years, 10 years, that people are more accepting of it, of doing this, taking this step, or is it still a real challenge that hasn't improved much?
I think among many aspects of Thrive NYC, something that our First Lady Shirlene McCray gets enormous credit for is putting mental health into the public discourse, having it be completely acceptable for sports figures, elected officials, young people, people in all professions to mention their own personal story, either themselves or a family member, what they've gone through. It is now much, much more common than it was 7 years ago. To talk about mental health, to normalize the need for it. We have 1 in 5 New Yorkers face a mental health challenge every year. And our hope through Thrive is that we normalize not only that so many people face mental health challenges. Think about it, if it's 1 in 5, you have to know somebody. It's got to be you, it's got to be a family member, it's got to be in your circle of friends. You have to know somebody, and we're trying to normalize seeking help. And then we're trying to make sure that when people do seek help, that there are plenty of resources available to them. But yes, I agree that the stigma is a real factor in not seeking help, but I think it's gotten better over the last few years.
I absolutely agree. I think it's, having been in this business for a long time, it's gotten much, much better. And I think it's been public officials who talk about it. It's been our governor, it's been the First Lady, it's been stars, and it's also been beginning to get embedded into the culture better. You know, the Mental Health Education Act, which is a law in New York State now, that you have to have mental health education starting kindergarten going forward. Of course, it varies what it is. Will now be something that will be talked about by school kids and their parents and their teachers in the way you talk about everything else, history, geography, what you talk about health in general. I think that's a tremendous stigma buster. I think the more we embed mental health and the understanding of mental health into what we do every day, it becomes like the rest of our health. It's just as important. And I think that is happening more and more. So hopefully the next generation that comes along will have a very different attitude toward mental health and will really just seek help when you need it, just like you do for everything else.
Right. And one of the ways that we're trying to get the next generation to do that is by teaching social and emotional learning in elementary school. That's part of the connection here, that if young children start to understand and name their emotions and understand what it means to regulate their emotions, they're well on their way to being able to talk about challenges when they face them, whether it's as a child or a young adult or an older adult. But they've been given vocabulary, they've practiced, and they've been given permission to talk about their mental health as though it mattered as much as their physical health. We all need tools to do that, and we've started to embed SEL throughout all of the schools in New York City.
Sure.
I just wanted to add that while we need the tools, we also need options, right? And so the telehealth has actually been really helpful, because if you're seeking services for the very first time, you don't have, there's no stigma of having to go into a clinic to receive those services, which, you know, we've been doing a lot with the older adult population. I know SPOT, for instance, does that really well. They are a nonprofit in Manhattan, and they actually come to the older adults home if that person is not comfortable going. So I think that, you know, having those options of not having to show up at a clinic are really helpful in reducing the stigma around seeking those services.
Mm-hmm.
Going to an audience question here. Can you speak to how you're trying to provide mental or general health services to children without tech, Wi-Fi, parks, support systems, etc., who are suffering in silence during this pandemic?
Well, first of all, in New York City, we've tried to get tech and tablets to children, school-age children throughout the city. And if someone still doesn't have that, they should contact the Department of Education, because we are trying to make sure that every student is connected, both for academic reasons and for health reasons. So on an ongoing basis, I think the question will be, can people still use their cell phones? Can they still use tablets? Will the regulations that have been waived at both the state and federal level about providing telehealth, will they continue to be waived? And our hope, of course, is that they will be.
Sure. Another question, will we get an email with the mentioned resources? We can check on that here at City and State, but we will have this video posted by the end of the day, typically on the event page, and we'll do a story on this that we'll post as well with the video. So you can go back and scan through and revisit any points you missed during the discussion. Another audience question, can you provide more information of the use of peers in communities of color?
Yeah, well, I think peers are critical in every community, and especially in communities of color, because they can really understand the multiple struggles, not just whatever the mental health issue is, but the entire community issues, and understand and help with that stigma too, because they've been through these experiences, and they can talk to them, and they can talk to them in a way that can be understood and trusted. You know, a big part of mental health services is also a trust between the person who's coming for the service and whoever's providing it. And I think peers bridge that, because still, sadly, I think that if there isn't always that trust factor when you cross communities, or when communities are going into a new place, or a clinic that doesn't feel as familiar. So I think peers are tremendously, tremendously important. And all the studies have shown that you get better and better results when you have peers involved in your treatment programs. So I think we're trying to grow that and make it even more accessible across, for all purposes, in all the clinics, all the services that we provide across the state. So they're just an invaluable resource.
Sure. Another audience question. Do we know how long OMH will continue to allow providers to provide telehealth, telemental?
Well, the part that's general telehealth that has a video kind of connection, I think we're on a good path here to be able to provide that, and probably to keep the expansion of the providers who can do it. So I think that part we're pretty solid on. The telephone is a little tricky, because the feds, you have to kind of check out with, and we're in the process of doing this, CMS and the feds, as to whether for Medicare and Medicaid, we're going to be able to allow billing for that. So we're not sure about that yet. It has been a tremendous boon to be able to do that. So we're looking into it, but I can't promise that one yet. We have to continue to look at it.
Sure. A couple more audience questions returning to law enforcement issues. How has recent social tension stemming from worsened police and community relations resulting from the death of George Floyd further exacerbated mental health issues already inflamed by the COVID-19 crisis?
Well, what I would like to say about that is that prior to COVID and prior to the death of George Floyd, we knew that people of color had more greater incidents of mental health challenges in New York City, and were already having trouble accessing care. So that's prior to all of this. We believe that COVID and the highlighting of the racism that exists in the country is only going to exacerbate all of these problems. So you're socially isolated, you're pent up, you're disoriented, you're sad, you're suffering grief and anxiety, and now you're suffering trauma of witnessing violence over and over and over again. And whatever racism you already experience in your lives has been compounded. So it's just another layer on top of all of that, all of those burdens that were created by the pandemic. We believe that this will have a mental health impact on everybody. And we realize that now we're adding trauma on top of grief and anxiety and depression and great loss.
And one more audience question, at least. I know some years ago it was discussed that every precinct in New York City was supposed to have a social worker and a psychologist on site. Is there any update on this?
So Councilmember Ayala could probably speak to that better. What I can say is that that was a city council bill, and what we do have is an advocate in every single precinct that works with victims of crime and abuse, and that the NYPD has also greatly expanded its health and well-being unit to serve officers. But I don't believe they have that sort of ratio per precinct. But the health and wellness part of the NYPD has grown dramatically over the last year.
Councilmember, anything to add on that?
Yeah, no, no, that's not happening. I think that, yeah, there was conversation I don't recollect this predates me in the council. I don't remember it being a conversation about, it wasn't a council funded initiative, but I remember sitting in on meetings with the Department of Health regarding the mobile crisis unit and growing that and expanding it, because only I think it was piloted, maybe I'm trying to think here, maybe 5 years ago. We discussed the possibility of ensuring that there was always a social worker with a police officer that responded, to mental health calls. I believe that has been expanded by PD. I don't remember off the top of my head right now how many precincts actually have that, but I believe that they rotate. Actually, the precincts that have it are not. So the social work is not specific to that precinct, right? They can travel by borough. Which is why we need them at every precinct, or at least at more, so that the travel time is reduced, and we can ensure that people get to a crisis immediately, or as immediately as possible.
Sure. Unfortunately, we're out of time. Thanks again to our sponsor, the Coalition for Behavioral Health. Final note, we'll be holding additional discussions in this series. The next webinar is on Tuesday, June 9th on reopening the economy, with Lieutenant Governor Kathy Hochul and Congressman Thomas Suozzi. Registration can be found on our website. Thank you all for turning in. Thank you for the great discussion. Thank you to our illustrious panelists. And that concludes our program.